Get Real Health is a little bit unique in that we did not start as a U.S. company that moved jobs to India. We started as a U.S. and Indian company and have grown both together. You know, there's been some commentary about the issue or concerns of outsourcing in the U.S. And I think a lot of times the talk is bigger than the reality. The reality is it is a global market, and the necessity to use services and production from all parts of the world, wherever the talent is available, is just a fact, and that's not going to change. And so, you know, I am going to be encouraging and welcoming you both to interact with U.S. companies here and come to the U.S. There are not enough software engineers in the U.S. Even if the pay is all the same, there simply are not enough people in the U.S. trained in software engineering. We need help from organizations and from countries outside to have that talent brought in and grow the capabilities that we have. So again, specifically, I'm going to be talking about healthcare, the opportunities in healthcare IT. This is a huge part of the U.S. economy. Does anyone have a rough sense of what percentage of the U.S. gross domestic product is spent on healthcare? It's about 18%, 17 to 18%. That equates to about $1.75 trillion per year is being spent on healthcare in the United States, which is, just to put it in relative terms, I think India's GDP is about 1.84 trillion. So it's an enormous amount of the economy is being spent on healthcare in the States. And because of a lot of nuances in the United States healthcare system, it's actually a much larger percentage than even most other Western countries. The Western European countries and Canada are closer to the 10 to 12% of GDP. The United States has a very unusual healthcare delivery system where we have many different payers, some government, some private, and because of this sort of fracturing of the healthcare market, it's less efficient, at least from a financial standpoint. And despite the high percentage of the U.S. economy that is being spent on health care, and when I say health care, I'm talking about everything related to health care, the delivery of medicine, the applications, the technologies. But despite this very high percentage, the percentage is going up. And that's a problem. There are a couple key reasons that this percentage is going up in the U.S. The first one is, just like many other areas in the world, people are living longer. And as they live longer, they get older. When they get older, they use disproportionately a lot more health care than younger people. Someone who is living in their 80s is probably going to utilize several times as much health care as someone who is in their 30s and in working age. The other problem, and this is true not just in the U.S. but all over the world, that is really causing more utilization of healthcare, more need for healthcare, is the change in lifestyle. More people are doing sedentary desk jobs. They're not out doing manual labor where they're exercising and burning calories. And we see a situation where people are doing sedentary activities combined with high caloric intake diets, and you have problems like obesity, type 2 diabetes, heart disease. These chronic conditions are becoming vastly more prevalent. And therefore, you know, this 17, 18% is just continuing to rise. And specifically in the U.S., there are changes in the regulatory landscape that are adding more people to the rosters and utilizers of healthcare. Recently in the U.S., there have been a number of reforms that have sought to bring healthcare to the uninsured. And for those of you not familiar, the U.S. has traditionally been a private payer healthcare system, unlike the European countries, which generally have universal coverage. And the recent the changes in regulation are designed to get close to universal coverage. So there's more people needing health care in the U.S. And the effects of this increased demand are creating a situation that's just not sustainable. If we're already spending 17% of GDP, how high can it go before the economy just breaks down? Healthcare is by far the largest expenditure of the United States federal government. The U.S. spends an enormous amount of money on military and whatnot, but even that is a small fraction of what the U.S. government spends on healthcare. And the U.S. federal government insures or provides the coverage to senior citizens, those who are very, very poor. It also provides the coverage to veterans and military families. And when you combine all of those groups together, it's actually the government is paying for more than 50% of that health care bill in the U.S. each year. Because of this, there is a huge need right now for solutions that are going to limit the growth of the expenditure on health care. We can't just do this in a linear fashion where as we add more patients, we just add more dollars and more money into the marketplace. And healthcare IT is one of the areas that investments are being made in because this is seen and has been demonstrated to be one of the areas that can help reduce this growth in the healthcare cost, to make the delivery of healthcare more efficient, to make it so that preventative medication and interventions can be taken that prevent people from getting sick. For example, a patient who has heart failure, congestive heart failure, if they come into the hospital every time that they have an issue, that's extremely expensive. If healthcare information technology is used and they're connected to a scale, a weight scale at home, and their providers are able to see what's happening with them and take preemptive action when they get out of range, this is what allows them to save money. And so healthcare IT is really one of the areas that more investment is being made in because in the big picture of healthcare in the United States, the investments made into healthcare IT save money. So again, the healthcare IT, as I mentioned, allows more efficient delivery. One of the big types of healthcare IT systems you'll hear about is the electronic medical record systems, or EMRs. And in the U.S. and all over the world, paper-based medical record systems have been a problem for a long time. The process of every patient comes in, gets a folder, their information goes into the folder, and then they leave and come back later, and it's hard to find the information. If they go to another doctor, that other doctor doesn't know about that information. It makes the delivery of healthcare very inefficient. So the EMR systems have been out there and are increasingly going out there to help to make the availability of medical information more widespread and easier to transfer. In conjunction with this, there's technologies that are being used called health information exchanges, which take the data from different hospitals and provide, it acts as a conduit or gateway so that it can amalgamate data from different locations so that doctors, when they go to look at a patient, aren't just looking at the information they have themselves on that patient, but they can look at the information from the patient's other doctors, regardless of where they've gone. These are all trying to address the problem of the availability of this information to enable care providers to more effectively deliver health. It also prevents a big problem in the U.S. right now and around the world, and especially in the U.S., of duplicative services. It's very common, or has been very common, for a patient to go in and get some medical imaging, an X-ray or an MRI. And they do that at one hospital, and then they're traveling, they go somewhere, and another doctor has a question, doesn't know of the existence of these other documents, and gets another set of MRIs done. These MRIs can be $10,000 per set. So enabling doctors to have a complete picture of the medical information of patients is something that can really help reduce the costs of providing health care. And then there are new opportunities in the healthcare IT. So the electronic health records, the HIE, electronic health records are fairly robust, even though they're not completely distributed. Only most hospitals have them. Most doctors that you go to on an outpatient, your general care doctors, have not had these. But there's a huge need for these, and this is some of the opportunities available in healthcare IT is to help work with organizations to get these systems in place. And to help spur the adoption, the U.S. government a couple of years ago passed some legislation called the High Tech Act. And this is an incentive program that for all hospitals and doctors, the government is providing funding to help them get on electronic health record systems. And these systems have to get these incentive dollars, the systems have to comply with a set of functionality, minimum functionality and interoperability that's known as meaningful use. It stands for meaningful use of electronic health record technology. And obviously these organizations, now that they have the opportunity to get funding from the government to help with this, are very eager to do so. And right now, at this very moment, there is a very high demand for the services to put these in place. This incentive program turns into a disincentive program if the organizations don't implement these systems within a couple years. Basically, the incentive payments go down and then turn into a penalty where they get reduced payment from insurers if they have not implemented these systems. So because of that, again, there's a huge market for these type of systems. There are other areas that address things, and this is really what our company, Get Real Health, does, that go beyond these clinical information systems. So traditionally, healthcare IT has all been about the information systems within a hospital, within a doctor's practice. One of the areas that has been a big difficulty is you look at the types of conditions that are causing the healthcare expenditures in the U.S. to be so high. And when you look at things like diabetes and obesity, hypertension, a patient can come into a doctor every 3 months, and if the doctor doesn't know what's happening with that patient after they go home, it's impossible for them to to intervene when things get out of control. And this is where what we're coming in with at Get Real Health is patient engagement tools, which essentially extend the functionality of these electronic health record systems so that patients can get access to their medical data and also have patient-provided data made available to the clinicians. When this occurs in an efficient manner, the clinicians, the doctors, the nurses who are caring for these patients can see the information from a patient in almost real time and take actions when necessary. I use myself as an example of this. As a type 1 diabetic, when I take my blood glucose readings, I have a little device here that's a glucometer. This data traditionally has been something that I just see myself. When this is connected through patient engagement tools like IPHR, it can be uploaded and my doctor can see this as well. And this is really the enabling type of technology. We talked earlier about the Internet of Things. And medical devices are a perfect example of this because it's using Internet technologies beyond just the traditional application model and connecting it to things that are monitoring health, behaviors. It's not just medical devices like this. If you've seen things like pedometers, there's one that's commonly available in the States called the Fitbit. It's a little tiny clip that you put on, and it measures how much exercise you do every day. It's great for people who are looking to get in shape, but it's also great for doctors who are managing patients who need more physical activity to get an idea of what they're doing. So about Get Real Health, we started our company in 2001, and we've been completely focused on patient engagement solutions since 2007. We've won a lot of awards for the technology and the solutions we've built, and we have partnerships with a lot of big industry organizations, Microsoft, Paradigm, TELUS Health is a big Canadian telephone company. We also recently launched one in Australia with a large telco there to provide our patient engagement solutions on top of their existing healthcare information technology platforms. This is just a list of some of the organizations that use Get Real Health solutions. And it also provides a little bit of insight into how we got into the market that we're in of providing a solution for patient engagement. When we started out in the healthcare field, we built custom solutions as a consulting organization for many of these organizations, like the American Heart Association, American Cancer Society. And what we saw after doing a couple dozen different applications like this as custom solutions is that about 80% of the requirements were repeated from one organization to the next. Now, we couldn't just build one big monolithic application that did all the functions that everyone would want and just install it on each of these organizations. But we decided we wanted to turn the services work that we had done into a product and be able to reuse that product with different configurations to meet different customer needs. With this toolkit that we've built, we're providing the set of solutions for patient engagement, and the whole purpose of an organization going into the patient engagement sphere is to improve medical outcomes. When a patient is less sick, they cost less money. The healthier a patient is, the less expensive they are. And that brings down the cost of insurance and the overall expenditure on healthcare. Aligned with improving outcomes is reducing readmissions to hospitals. It's very common for people with chronic medical conditions who go into the emergency department at a hospital to be back for the same reason within a couple of weeks. And in the U.S., as part of the legal reforms, they've changed it because they want hospitals, they want doctors to follow up on the care of patients after they leave. So they've said that a patient who comes back into the hospital for the same condition within 30 days, the hospital doesn't get paid for the second visit. They have to pay for it out of their own pocket. The hospital has to pay for it. So now there's a big financial incentive to improve the quality of healthcare delivery and be able to follow up on the health of patients after they leave the hospital. It's no longer good enough to just see a patient, treat the condition, and send them home with a paper telling them what to do. The hospital has to be proactive and ensure that they're actually following up with the patient and providing the necessary care. They also need to have the ability to help transition the patient to other care providers after they leave, and healthcare IT is the thing that allows that, to take that medical information that the hospital and the patient have collected and ship it over to someone else who needs it, who's going to provide follow-up care. And patient engagement does work. We've done a lot of studies of the use of our solution, and what we see is that when patients are engaged, when they're being brought in, being provided the tools to follow and manage their health care, that it does bring down the readmissions. If we look at the first thing I said about the readmissions within 30 days, when no patient engagement is used, the number of patients that are readmitted within 30 days is about 28%. When there's deep patient engagement, that drops to 13%. That's dropping the readmission rate to less than half, which again, from a financial perspective, is absolutely enormous. Along with that, there's a big reduction in medical errors when the information is freely flowing between patients and providers and between all the care providers on a team. One example is with the diabetic population we did in Washington, D.C. We found that patients who utilize the tools that we have and the connected glucometers so that their care teams could see what their average blood sugars are, the blood sugar readings are, their average blood sugar, and this is a U.S. unit, I don't know if it's used here, it's milligrams per deciliter, went from 181 down to 153, and that's enormous from a healthcare standpoint. It means the difference between that patient, in many cases, being someone who is going to be able to manage that condition well, and someone who is going to go into kidney failure from the condition or have other serious complications. And serious also means expensive complications. So again, keeping people well through whatever mechanism available, but especially healthcare IT, means a reduction in cost. So what is our tool? So I mentioned earlier the different proprietary systems we had made earlier. And when we saw the nature of all of the different repetitive things that we were building, we found that we could provide a modular toolkit. So instead of building one big application that has every feature, we basically made a toolkit of building blocks, of little widgets, or for those of you in web programming, user controls. And each of these controls, through a content management system, could be placed. So our platform could be used for anything from a diabetes management site to a wellness and exercise site, depending on which set of widgets and features an organization wants to use. One of our earlier speakers talked about the concept of variability or variabilization. And this is really what IPHR was designed to be, is allow organizations to customize exactly the set of features they want without having to go out and do extensive code modification. By having the configurability of a solution, you go a long way towards getting making the type of solution an organization needs quickly available. Again, the connected devices are very important, something that we build into the system. Connected devices mean that patients don't have to come in and type in data, because patients are lazy. I'm lazy. I'm a good patient, and I wouldn't go and type in 5 readings a day. However, when they're uploaded automatically from my glucometer, it's a no-brainer. It happens automatically. When we go into how to design applications, one of the things we realized is that there has to be, especially in the healthcare IT field, there are a lot of disparate systems, and you need to have compatibility, have communication with different things. So the platform that we designed, if you look at the areas that are yellow here, has a lot of areas that can have plug-in adapters so that it can talk to different data sources, to different authentication systems, to different device ecosystems. So for those of you on the IT side, design your system for the unknown. Design your systems when you're building them so that you have modules, layers of your application where you can extend it, design for the things that you may want to do in the future but you don't know the answer to today. Also design for scalability. One of the things that we knew down here is that the scale of the organizations using our platform range from small hospitals to entire provinces and countries. The province of Alberta, Canada uses our system, Instant PHR, as the personal health record for 5 million people there. So we had to come up with a system that allows massive scalability. Don't think about scalability and performance as something down the road. Design your solution up front so that you can scale it as you go along. Again, build applications that are modular. Build them so that they're interoperable, that you can easily plug in adapters even if they don't exist yet. Make sure you have scalability and fault tolerance. Nothing kills an application like it not working or being able to be taken down by the failure of one critical component. And in the healthcare IT world, especially very much so in the US as well as the rest of the world, security and privacy. There are some types of information, people talk about Facebook security and people can see stuff, and that the security breach is there and how sensitive they are. In healthcare IT, if you have a serious security breach, you might as well just be out of business because no one else will buy your product. So there has to be a huge amount of emphasis on that. I would encourage you all to take a look at getrealhealth.com. There's a lot of information about what we're doing up there, the types of solutions that we've built. And I'd also like to go into, just for a moment, if I have time here, to talk about one of the threads that's been repeated during the sessions today, and that is in terms of working with organizations in the U.S. It's been said many times today that don't just say yes. I'm the CTO. I'm formerly a developer, and I still do enough development to be a little bit dangerous. But when I have an idea or design and I give you specifications for it, if you see a problem in my specs, the worst thing you can do is say, okay, and then go off and build something that you know doesn't work because it hasn't been communicated. The next best thing, but still not perfect, is you telling me there's a problem with what I've given you, but not giving me a solution. Telling me a problem, okay, now I know there's a problem. Better than that is telling me there's a problem and telling me, based on your deep understanding of the fundamental business requirements, what you think the better solution is. And this is important. It's not good enough to know the specifications in development. You need to know what the fundamental issues, the fundamental problems a solution is trying to solve are, so that you can give your own insight, your own wisdom to help come up with solutions. And then the best thing of all is an employee who not only has that ability to tell me what they think they would do better, but to come up with brand new ideas that we haven't even thought of for features that would enhance the value of what we're doing. You know, the easiest way to get a promotion for me is to show me that I'm wrong about something and show me that you have a better idea. That is a great thing, and I love to see that. I like to hire people who are smarter than me, and probably most of you are smarter than me. I never went to college. I was self-taught, but you know, you all have very distinguished educations and are, I'm sure, very good in your field, and I want to see that. I want to know that the education, the learning that you have is producing ideas that are improving the business, improving the product for us. So if you are interested in healthcare IT and knowing how big this market is, one thing that's very good is you don't have to worry about which specific platform you're working on. Now, there's certainly a lot of movement into mobile applications, but healthcare IT is also a big and very old legacy. There's a lot of, the biggest electronic healthcare systems in the US right now are written in a language called MUMPS that came from the 1960s. It has an embedded hierarchical database, so it's not even relational for some of these. So there's a huge diversity from those old systems written on old technology in COBOL and MUMPS to mobile applications written in Objective-C and Java and everything in between. So if you're interested in the field, regardless of what technology set you're familiar with, there are probably a lot of opportunities in healthcare IT. If you're also interested, spend some time learning about the pieces that are prevalent in the healthcare IT industry. Learn about the functions of electronic health records, what the things that they do, how they interoperate. The same with health information exchanges and personal health records and health devices. You don't have to know all the details, but learning the basics about the interoperability of these and how they fit together is really important to getting a foot in the door in this space. And then there are standards in the healthcare IT. HL7, which is essentially a set of schemas for XML documents, which have become the standard for medical information exchange, and the clinical document architecture, which is based on that. Whenever we talk about these systems, like our patient portal interfacing with electronic health records, it's always using these common set of data representations and interfaces, and learning about those is a great way to make a solid entrance into the healthcare IT marketplace. And again, you know, the reasons that we are looking for people from India is that the U.S. is simply not producing enough software engineers, and the economics for some of the types of development. Generally, bringing people from India to the U.S. is done to solve the lack of available people in the U.S. outsourcing or offshoring development to India is done for a different reason. That's based on when the type of work isn't economically feasible. Organizations like Get Real do both. We have people who we've brought over from India, we have domestic developers and architects, and we have people in India all working together to implement the solutions. And it's not a one-size-fits-all. For an organization like ours, we need all of those types of people to effectively operate. Again, we do the bulk of our actual development here, and Raj, who I showed you earlier, has been with us for 13 years, and if you're interested in learning more about the RCKR software, which is our Indian subsidiary, you can email Rajesh at rckr.com, and we'll let you know. We very frequently are hiring, and we've been expanding at a pretty steady clip over the past couple of years.